All right, you're welcome. This is Celebrity Pharmacologist, and today let's compare diclofenac versus naproxen. If this is your first time of coming across any of my video, please do want to follow the Celebrity Pharmacologist, like and share this video. Please drop comment in the comment section. Don't forget, especially for those of you that are into health courses, medicine, or even pharmacy. Now let's discuss this. Yesterday, or in our last video, we discussed diclofenac versus ibuprofen. But today, let's look at naproxen. First things first, I want you to know that they are both classified or they are under the class of drug called the non-steroidal anti-inflammatory drugs. That's NSAID. For a better classification, this is what we call this diclofenac is under the class called preferential COX-2 inhibitors. There are other drugs that are under them. And when we talk about naproxen, it's the same father, the same mother with that of ibuprofen. So I'm talking about the propionic acid derivative. So propionic acid derivatives, that's where the naproxen is classified, or that's where it belongs to. So, but however, propionic acid derivatives and the prevention COX-2 inhibitors are generally under what non-steroidal anti-inflammatory drugs. And we said what they act by inhibiting cyclooxygenase 1 and cyclooxygenase 2. So they inhibit COX-1 and COX-2. And one of our videos, we said that the main enzyme that is responsible for pain is what COX-2. That inhibiting COX-1, which is a maintenance enzyme, is useless when we are talking about pain. So when we talk about the mechanism of action here, you see that naproxen inhibits COX-1, and what? COX-2. While diclofenac is a preferential COX-2 inhibitor. Listen, it prefers to inhibit COX-2. It prefers, but that does not mean it does not inhibit COX-1. So because of this now, you see that diclofenac is actually winning when we talk about mechanism of action. Now let's talk about their onset of action. Diclofenac, especially when it's being paired with potassium, diclofenac potassium, it's very, very fast. The onset is around 20 minutes to what 60 minutes. You get the effect. While for that of naproxen, it's almost similar. Like it's very, very competing with diclofenac. So for naproxen, it's around what 30 minutes to 60. 30 minutes to 60 minutes, you start seeing the effect of naproxen. The duration of action, this is where naproxen is likely what better, because naproxen can work for like 12 to 24 hours. That's why it's mostly given like BD. Yeah, BD. They used to give it BD twice daily because of how long it stays in the body. Why for diclofenac, it's as usual 8 to 12 hours. It's usually given what BD. Some people, depending on the dose, do give it TDS. That's three times daily, but it's advisable it should be what BD. The half-life of diclofenac is same as what 1 to 2 hours. Why that of naproxen is 12 to 17 hours. So it stays very, very long and keep giving its effect for a very long time. But one thing I want you to know is that they still have the same GIT risk. So it's not advisable for ulcer patients, whichever formulation you are going to come with, except they bind them or they combine them with drugs that can help for GIT. For instance, diclofenac do come with what? Misoprostol. Why naproxen do come with isomeprazole. Later, I will tell you why it's being combined. In another video, I will talk why it's being combined with isomeprazole. Why not pantoprazole? Or why not omeprazole? Why is it isomeprazole? We'll discuss about that in another video. But for diclofenac, it's misoprostol. That's one of the best combination. Now let's talk about their cardiovascular risk. For someone with any cardiovascular disease, you should be very conscious while you apply diclofenac. Someone with high blood pressure, someone with anything that has to do with the heart, angina pectoris, please you have to watch before, you have to ask questions before you give diclofenac. While for naproxen, it has shown that it's the effect on cardiovascular diseases is a little bit is slightly better than other NSAIDs. However, I'm not saying it's safe, but it's a bit better than what other NSAIDs. So it's slightly good. slightly better. Not that it's the best, but we can still what consider it. NSAIDs generally are not actually safe for people with what kidney failure or kidney issue. So just have it in mind whenever you're talking about NSAID, it's not good for anyone with kidney failure or kidney disease. Now let's talk about indication. So diclofenac, as usual, it's good for what acute pain, post-operative pain, anything that when you need a rapid response concerning pain, diclofenac is what the best option. For instance, someone was involved in an accident, diclofenac is also the best what option. Now talking about naproxen, it's good for chronic disorders or chronic pain like osteoarthritis, chronic back pain, gouge, rheumatoid arthritis, any kind of pain that is going to last long. When we talk about dental pain, dental after surgery, anything after surgery, we mention what diclofenac. But something that is very long, that will stay long in the body, naproxen is what better. That's the better drug of choice for such conditions. I think we have come to the end of this very video. In the next video, we'll be discussing some questions about this very topic. Please don't forget, whenever I ask a question and your answer is A, please don't just drop A and go. Or if your answer is B, don't just drop B and go. Tell me why your answer is A and tell me why your answer is B.